with WHHI-TV, and we're going to continue our conversation about offering medical clinic care for our community. I have Dr. Newman from Hilton Head. I have Toney, who's here with the Bluffton Jasper, and I also have Kirkpatrick here from Beaufort. And we are having a conversation about, the community that these clinics serve. And so today, or now we want to talk about is the different programs that each clinic has, because they're similar, but yet they're different. So there's different nuances I think we should share with you, and plus the location. So let's start with you, Dr. Newman.
Yeah, so in Hilton Head, we have primary care, we have mental health, we have dental, we have a collective of family practice internal medicine, but we've also got a lot of specialists who've retired to the island. So we've got endocrinology, pulmonology, neurology. And so those are the specialists that are sometimes very, very hard to find. And so we're fortunate that we've got these specialists volunteering in our organizations helping to care for our patients. So I'm incredibly proud of the specialty clinics that we have. A lot of people have a perception that free clinic is free care is not necessarily good care. And I would tell you, what I'm most proud of is that we've got some of the smartest doctors, some of the smartest nurses. We're driving some quality, and we don't compare ourselves to free and charitable clinics. We're comparing our quality with the Mayo Clinic and the Cleveland clinics, because the one thing we have is we have time. And we have time to spend with our patients. And if you take a loving, caring group to care for a patient and you give them time, it's amazing what you can accomplish.
Yeah, that's a really good point too, in healthcare, because everything is time sensitive, correct? You have 15 minutes with a patient, not 16 and all that kind of things. But it's, as you say, and I do know the quality of professional care through the doctors, the nurses, and all the other supporting staff is just amazing here in the Lowcountry. So we're very fortunate. And if you know anybody who is a doctor, is in medical care, do call the clinics. They were always looking for help as well.
Yes.
So that's a Hilton Head. So let's talk about the Bluffton Jasper clinic care.
Well, we're a little bit smaller, and so people always think that we're part of the Hilton Head Clinic, which we're not. So that's always a little bit of an issue, and we certainly do wonderful care. Our doctors and nurses, I think, are equal to all of our free clinic doctors and nurses. They are specialists in their field. We've got cardiologists and endocrinologists and family health and OB and GYN services. And so our doctors are here because they really want to be here and love to take care of the patients. And just following up a little bit on what Dr. Newman said, our cardiologist said one day that he can spend as much time as he wants with the patient, which he really likes. Now, on the flip side of that, sometimes that means that our patients have to wait a little bit longer and wait a bit. And so I've gone out occasionally and, we'll see somebody that's been waiting 45 minutes for their appointment. And then I always say to them, but when you get in there, you also could have that 45 minutes. And so that always makes a big difference. And our patients are so incredibly appreciative for what the care that our doctors and nurses provide for them, and our administrative staff. Where we have about 4,000 patients on roll, and of those 4,000, about 1,500 come to us each year for about 7,000 patient visits. And so we get to know our patients and their families. And so it really is a true home, I think, in every sense of the word.
I have to say that when you walk through the doors, and I've been here several times now, there is a great feeling of confidence that you're going to be provided for, taken care of, and you see people sitting in the waiting room and you can feel that they're uncomfortable if they're not feeling well. Obviously, they're here because they're not feeling well, but there's also this feeling of they're going to be seen, they're going to be taken care of. And, that's wonderful. And it's a beautiful facility too, so I really think that's important to understand. All the facilities are. And with you, Cassi, tell me about with Beaufort, what is specific there with your clinics?
Well, we're the smallest of all three. And probably what's unique is we were started as a faith-based clinic, and we still follow a lot of those principles. And that's a very comforting thing now. We include everyone, but we were faith-based to start back in 2007. And I would, kind of piggyback on both of them to say that the quality of care is just so impressive. I have a young staff. Everybody's just over a year, a small staff, but everyone's like, gosh, can I come here? Because everyone gets great time and great quality. And that's so important. And one of the things that we really pride ourselves in is that holistic approach. We have a referral system. And if a provider seeing a patient happens to hear during that visit they're homeless, he jots it down and sends in a referral. And then we process that out. And we try to help them from the big picture, because obviously if they don't know where they're going to sleep, then there's a whole other basket of things that go with that. So we really try to have implemented that model this past year, and wow, what a difference. We've reached out to United Way and some of our partners to really help these patients, full circle. We saw over 3,000 visits last year, and outsourced a lot of referrals, but we also have referrals in-house. And then the other thing that we've done this year that has been really unique is that we don't have mental health inside the clinic, but we wrote an MOU with a practicing partner, Coastal Empire Mental Health, which is literally walkable from our clinic. And that has been a big new thing that we've done this year that's been really important for our patients.
Well, it sounds like you're in a great location too. You're right across from the hospital.
Yes.
Are you looking for physicians as well, nursing?
We are always looking for physicians. We do have a lot of specialty, but as it is a retiring population, it's often an aging population, so we always want to build the bench. And one of the things that I have found in my recruitment is that a lot of providers think that it's a big commitment. It's not. It's not a huge commitment. You can come and practice medicine or practice your nursing skills in a 3 or 4 hour shift a couple times a month at our clinic. I can't speak for how their setup is, but this is what people's lives have been about. And so one of the missions that we have that's not really in our mission statement is that we provide purpose for retired medical providers, and they love it.
Wow, this is great. Well, thank you for that. But we have so much more to talk about, so don't go away. We'll be right back with more 843 TV.